Stefan, thanks again for being here. Today, we're going to talk about a self-care tip that's really could be a benefit in a year where we didn't see any of this coming. We didn't see COVID-19 coming. We were gearing up to celebrate the year of the nurse and the midwife, and now that has a completely different meaning. Times have changed, and there may be a new normal. What is the one thing you would recommend nurses to implement in their life given what we're going through?
Okay, one thing, I think given the times, everything's happening very rapidly and things are changing every day. So I've always recommended journaling. The thing I will call it now is a journal log, and that's because I kind of separate the whole idea of a journal and the idea of a log. And, the journaling would be to, again, we're living in an unprecedented time where everything that's happening now is going to go down in history. And so not only to look back on, but to help release and to help yourself, self-care-wise, to notice things about yourself. And I know that documenting is the most daunting thing for nurses, but I'm going to tell you to do it again because it's so important to get this stuff down. And if you think about why we document at work, right? To keep a record, to look at trends, to reference. It's the same for this. Journal about how you felt that day, what happened, were you angry, were you happy, who were you mad at, if anyone, who made you happy, what were you thankful for, were you fearful of anything, those kind of things. And document them as if you were charting vital signs. That way you can look at it page by page and notice trends. And that's really very informative to look back on, because if you're writing down that one of your colleagues is upsetting you every day, you're gonna notice that. You're gonna notice that you're writing down, their name constantly, every single night. You're gonna find somewhere, whether or not it's inside of you, outside of you, upstairs, wherever it is, there's an answer, there's a solution to it. I think looking at it in that light is the best way to do it. Otherwise, you're just gonna get sick of writing their name down and you're gonna say, okay, listen, I gotta do something about this, and then just, deal with whatever it is at work. But that's kind of the journal side of it. It's really about noticing those things that you can improve on, self-improvement, noticing what kind of character defects you have, resolving those to be a better person ultimately.
So talk about the log portion of documentation.
Yeah. Because of everything that's happening so quickly, there's so much misleading misinformation and misconduct that's happening right now. Inevitably, when lawsuits are flying around left and right, what do we do as nurses to CYA? Document, document, document. It's gonna help you in the future. If something happens, if you feel like you're being pressured into doing something, or if you don't think something right happened, then that is likely to come up in the future. So if you have a log, that's gonna serve you very well, not only for your own brain, but just in any sort of legal situation. So, and say you don't like writing, you could always pop open your cell phone, use the voice recorder, captain's log, start date, I've got no idea because I've been in the hospital for 84 hours, right? But the most important thing, however you want to do it, is as long as you're releasing emotions and recording encounters, those two things will be invaluable for your future.
Thank you, Stefan.
My pleasure.
I just want to say thank you to our nursing colleagues out there, and we hope that you find this series of self-care tips beneficial to you, willing to explore others that would help support your work and your life. I would also love to give a heartfelt thank you to Nurse Stefan Torres and sharing with us his talent and his stories to help inspire others to find self-care that works for them. So thank you again. To see more information about the Center for Nursing, you could visit our website at www.wcnursing.org. We are also on social media on Facebook, Instagram, YouTube, and LinkedIn. And if you'd like to support additional programs like these, please consider contributing to the Washington Center for Nursing. We are a 501c3 nonprofit corporation. Thank you so much for your work, for caring for your patients, contributing to our communities, and please stay safe.